The mouth is emerging as an oral health care is emerging as one of the most important risk areas for cognitive decline and ultimately Alzheimer's disease. And therefore, it's becoming critical for people to see oral systemic specialists, dentists who are actually trained in systemic health, so-called oral systemic specialists. And they are going to play an important role in treating and preventing Alzheimer's disease, along with the interaction with health coaches, internists, functional medicine physicians, integrative medicine physicians. All of these players are turning out to be critical. And as you indicated, just let's go into the oral area for a minute and look at all the different things that go wrong. So as you mentioned, let's start with gingivitis. If you've got some blood on your toothbrush, you know that you have a connection between your oral cavity and your bloodstream. That's a given. And this is going to increase systemic inflammation. Where are they finding these organisms? They're finding them in plaques that are giving you myocardial infarction. They're finding these organisms in cancers, and they're finding these organisms in plaques of amyloid in your brain associated with Alzheimer's. So these things are going far and wide in your body, and we want to do the best we can to prevent that. So as you mentioned, regular flossing, which again, you laugh at this stuff, but it turns out to be critical. And then knowing the microbiome, and there's an easy way to do that now with something just oral DNA, which is from MyPeriopath, and I have no relationship with them. But again, we're just looking for best outcomes. So, and I'm sure there will be other groups that will check your oral microbiome in years to come. But they'll tell you, do you have a high major pathogens? P. gingivalis is the one most associated with Alzheimer's, but there are other significant pathogens, T. denticola, Prevotella intermedia, things like that, Fusobacterium nucleatum, all of these things that are pathogens in the mouth. And so you can get these reduced. And in fact, we recommend that people simply use Dentalcidin. And again, I have no relationship with the group that makes Dentalcidin. We're just interested in best outcomes. And that can improve your oral microbiome. So the good news is all these things that we can now measure, we can address each and every one of them. There is something that can be done. And then you mentioned the amalgams. Here's a separate contributor. Many people who have these mercury amalgams will have so-called silver fillings that are a bit out of date, but they've been used for years and years and years, and many people have them. These can increase your mercury level, and this can increase your risk for cognitive decline. And many studies have shown that. And looking at mercury, and by the way, if you want to just give one toxin to create the pathology of Alzheimer's disease, mercury is probably your best bet. It creates both the plaques and the tangles of Alzheimer's disease. So again, looking at what your mercury status is and addressing that. Periodontitis, addressing that. It's critical. Again, typically associated with things like P. gingivalis. And then a whole other area, which is sleep disordered breathing. And it turns out, unfortunately, that so many of us grew up with not having the right exposure to things like roots. And therefore, we end up with smaller mouths, smaller airways, and we end up with sleep apnea or upper airway resistance syndrome. It doesn't just have to be sleep apnea. So we recommend everybody, please get your oxygenation checked. It's simple. You can get a little oximeter. You can borrow it from your doctor. You can buy it on Amazon for about $35. Or you can use an Apple Watch, see where you stand at night. While we're sleeping at night, we should be in the 96 to 98% range for our SpO2, for our oxygen saturation. If you're dropping down below 90, you are hurting your brain. And in fact, there's a beautiful study a few years ago where they just looked at the relationship between the average SpO2 at night and the size of your hippocampus and other nuclei in your brain. And there is a beautiful correlation. As your O2 is going down at night, your hippocampal volume is matching up. Now, again, that one study doesn't prove causation, but it's highly suspicious. So we should know if we're dropping our oxygenation at night, and that's associated with things like atrial fibrillation as well. which in and of itself is associated with cognitive decline. So there are all sorts of bad things that happen if your oral care is not good. And the good news is we can address all of them. There's a group called Vivos now that is actually expanding the airways over time. It takes a year and a half or so, slowly. It's a little bit like having braces, but in this case, you're having a retainer. They're basically expanding your oral pathway and getting better airway, better delivery of oxygenation. Such a critical thing to do. So it turns out that, as you were alluding to, what's going on in your mouth, in your airways, is a critical piece of staying sharp.
What are your thoughts on cavitations from previous wisdom tooth surgery or root canals?
Great point. And the thing is that they can be infected. And so many people don't realize that they have infection. So what we've done in our trials is to do cone beams so that you can actually look to see, are there cavitations that are being missed? And unfortunately, there can be. Are there potentially infected root canals? And these things, again, should be cleaned out. And because anything that's giving you chronic inflammation, chronic infection, chronic access of pathogens to your brains, any of those things is going to be a potential contributor to cognitive decline.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
We actually have a pro-inflammatory state with ApoE4, and so we have a slightly shorter lifespan and, of course, a markedly increased risk of developing Alzheimer's. Great. So we can address that.